to expand the conversation, we now speak to Dr. Lulume Bayiga, who's president of the Society for, as we expand the conversation, Dr. Lulume Bayiga, who's president of the Society of Uganda Private Medical Practitioners Association. A very good evening to you. Thank you so much for joining us. Welcome.
No, thank you very much. This is Dr. Bayiga Michael Lulume. I'm Ugandan and the president of the Society of Uganda Private Medical Practitioners.
Thanks for that. Let's perhaps get right into the thick of things. Uganda is now officially on a 42-day countdown to be declared Ebola-free. I mean, that, of course, must be a relief.
Indeed, it's a relief because Ebola was a problem. It killed one of the prominent doctors about 20 years ago. And that was the first time we heard about it in Uganda. And it scared both the private and the public practitioners. Dr. Lukuya at that time was in the public practice. He's one of the government doctors who did a lot of work to ensure that people are saved from the death of Ebola, but he died of Ebola himself. So once this scare came, and we have just come out of COVID-19, it brought back the memories of Dr. Lukuya and the struggle against Ebola, which killed a number of people. So we took it very seriously, and the scare contributed to our seriousness in handling it.
Yeah. And as you speak about that, I mean, we are looking at this 42-day countdown before Uganda can officially be declared Ebola-free. But some say that the country might not be totally free of Ebola and that the announcement perhaps is pushed by politics and tourism losers. What is your take on that?
Yeah, that could be. But at the same time, I have been just reading the ex of the son of the president, calling it Ebola scare. But according to the Ministry of Health, the various cases that had been tracked were cases that came from Congo, especially the first case that was reported. And then the contact, of course, contact tracing is one of the most important things in surveillance system to ensure that those contacts are they receive the care and to avoid the further contacts.
Yeah, and that's, of course, a very important aspect that you raise because the DRC has now recorded more than 2,000 confirmed cases and the WHO believes the real number could be at least double. How concerning is that gap between reported and actual infections?
Yeah, in Uganda, it would be easy because those who, the person who had the disease, the one who had been diagnosed, it was easy to have that one isolated and then to have the contacts also looked into, to look at them in their various aspects to ensure that nobody is left untouched.
So with the cross-border movement continuous and continuing, I mean, there's a lot of back and forth. What is the biggest risk to countries neighbouring the DRC? And are their surveillance systems strong enough to perhaps quickly detect some cases to prevent the spread? And, you also mentioned the importance of contact tracing. Perhaps give us some clarity there.
Yeah, I think the government of Uganda has done a good job in trying to see that cross-border movements, health at the cross-border movements are controlled so that people who are coming into Uganda, especially from the Democratic Republic of Congo, have their I mean, they have, they must go through a system to see whether they have symptoms, whether they have signs of the disease. I think that is being done quite seriously. But at the same time, ensuring that any kind of signs and symptoms within the public and the private are also looked into, and the measures have been instilled and vigorously followed up, especially in the private sector, which sees 65% of the patients in Uganda. So there has been a rigorous mechanism to ensure that everybody gets involved in detecting any signs from any patient, be they from coming from malaria, because the common denominator has been a fever. Of course, before bleeding comes in, a fever is a constant denominator, which has been stressed. Buying of temperature guns, hand washing mechanisms, and conscientizing medical practitioners has been on the mouth of everybody in the public realm. So I think that has been done.
Yes.
But what we fear is the porous borders, because you cannot talk about stopping anybody from the Democratic Republic of Congo coming into Uganda. It is very difficult because it is not just one road that comes into Uganda. The borders are very porous. It's only one border point that you can talk about, but the sides of the border posts, you cannot prevent people from walking in and out.
Absolutely.
Some of them are relatives. Some of the relatives, real blood relatives. You get Ugandans across, you get Congolese, different cultures altogether. While they are in Congo, different ways of doing their things. While they are in Uganda, it's a different setting altogether, but they are relatives and they keep on moving from one country to another. It's very difficult to stop them.
Dr. Bayiga, as you speak about, some of the challenges, I mean, the pressing challenges about how the porous borders cannot be stopped, and you're also emphasizing the importance of hygiene and detecting signs from patients. Right at the beginning of our conversation, you spoke about the history that got you to this point in terms of some of the mechanisms that have been put in place to curb the spread of Ebola and ensure that to some degree Uganda is Ebola-free. Has the response to the Ebola virus improved since previous outbreaks, or are you perhaps still looking at the same challenges around testing, tracing contacts, and, I mean, the big one around community trust?
I think there has been capacity building over time. There has been some capacity building over time from those days of Lukuya. Then we went into COVID-19 to build preparedness into epidemic control. That capacity has been built over time, and the population is also alert when the Ministry of Health comes to alert them about any outbreak of a disease that can become an epidemic or a pandemic. That is a plus in the health system in Uganda, and I think we can really applaud government for doing that, especially the Ministry of Health.
As you applaud the government, perhaps brief us on the challenges of the past weeks as the health system of Uganda was fighting the virus, because out of that will come some important lessons for other countries.
Sorry, I beg your pardon?
The challenges of the past weeks, I mean, brief us a little bit on that. As the health system of Uganda was fighting the virus, what were the big challenges that you were facing that could perhaps form as lessons for other countries in a similar position?
Yeah. First of all, the scare was not extremely big, and I think somebody can say that we even overreacted, because this was a single case that had been reported. But of course, because of the seriousness of the disease, somebody could not sleep when a scare of a single individual, because of the externalities it comes around with, especially when there are contacts that have been associated with a single individual. So the enormity of the problem is dependent on the seriousness of the virus. Ebola is a very serious virus, and therefore, although it was not a very big scare in terms of how many people had been caught infected by the disease, it was taken seriously to the extent that a pilgrimage to Namgongo, where we see tens of thousands of pilgrims coming from all over Africa to Namgongo, had to be stopped. And it had to be obeyed by the religious system. Can you imagine? It was something that we could not take, therefore, the disease could not be taken lightly.
Absolutely.
It had to stop. A public holiday with a very big religious event that brings together the Catholics, the Protestants, the Church of Uganda, and the Muslims together into tens of thousands of people who come to Namgongo. But because of a single individual who had been diagnosed to have Ebola, that event had to be cancelled. So that is the seriousness with which Ugandans took the Ebola scare. I mean, how scared it became.
Absolutely.
And how seriously they take it. And how seriously they take the public health measures, especially in terms of hygiene, and for the practitioners to have those mechanisms to prevent themselves from catching the disease, but at the same time ensuring that they don't catch the disease, of course, from the patients who come their way, but at the same time spreading the disease to anybody who comes their way while undertaking treatment.
Absolutely. Some insight. Thank you so much for speaking to us this evening. That was Dr. Lulume Bayiga, who's president of the Society of Uganda Private Medical Practitioners Association.